Hello, my name is Travis Campbell, and today I'll be talking to you about the increasing lung cancer early diagnosis through lung cancer screening in Goodyear, Arizona. Let's talk about some of the facts about lung cancer. Approximately 234,000 new patients were diagnosed with lung cancer expectedly in 2018, which represents about 13% of all cancer diagnoses. Usually, those diagnosed with lung cancer are near retirement age. In 2015, 86% of people with lung cancer were 60 years or older. Cancer care is costly. The National Institutes of Health estimate that cancer care cost the U.S. an overall average of $147.5 billion in 2015, 13.4 billion of which were due to lung cancer. Lost productivity was also an issue. The last data that we have is from 2005, which showed that there was $134.8 billion lost due to early death from cancer, and 36.1 billion of that was caused by lung cancer. Let's talk about lung cancer screening. The CDC recommends lung cancer screening for those who have a history of heavy smoking, which is a 30-pack year or greater smoking history, those who currently smoke, or have quit within the past 15 years. According to the United Health Foundation's America's Health Rankings, Arizona has only decreased the number of smokers over 20 years of age by 5%. So we're at 15%, still not anywhere near the healthiest state, which is 9%. So there's definitely some room for us to improve with that. There's also been government studies that show the benefit of lung cancer screening to reduce the mortality from lung cancer by up to 20%. So screening programs for early detection of cancer are not new. Mammography and colonoscopy are good examples of established programs that are very well known and talked about. Lung cancer screening hasn't had the same success, however, getting off the ground. Many patients are unaware that here in Arizona, there are many insurance companies that actually cover the cost of low-dose CT scan for early detection. A 2018 review published by the Journal of Clinic Oncology looked at lung cancer participation rates. They looked at data from 7.6 million eligible smokers in the year 2016 and found that only 1.9% of these people were screened for lung cancer, while 85% were given smoking cessation materials. This shows that there is significant improvement on all sides, including providers, patients, and hospitals to increase these rates. Now let's talk about the social determinants of health that would be addressed through lung cancer screening. The two main ones that would be addressed would be health and healthcare and that of employment. The health of the local people here in Goodyear, Arizona are at increased risk for developing lung cancer for those that smoke or have smoked, and it's something that cannot be ignored. It is much easier and cost effective to treat a patient with any cancer early in the process, and that is why it is such an imperative for other types of cancers. It needs to be prioritized in the same way for lung cancer. This will help decrease the overall cost of healthcare for later stage lung cancer and its associated devastating effects on those in the local area. As we work with local individuals to increase their awareness and participation of this program, it will also allow people to work longer and with less likelihood of having to leave the workforce early due to a later stage lung cancer diagnosis. Now let's talk about the goals of a cancer screening program. Obviously, a main goal is to find the lung cancer, but beyond that, it's to help educate patients and providers about the importance of early detection and local options available. There needs to be a center that has dedicated screening protocols for lung cancer screening, with capability for low-dose CT scans to minimize radiation, along with significant outreach and support to increase awareness and availability. A large number of eligible smokers or former smokers in our area need to know about the benefits of lung cancer screening. If smokers knew that they could reduce their risk of dying by 20% through early detection, that could help persuade them to seek it out, or to at least go through with it if recommended. However, in order to start a program like this and to sustain it and make it successful, you need support. That is where the Cancer Treatment Center of America, where I work, has a unique tool, and that we have a whole support system already in place for other screening programs with nurse navigators, physician assistants, and doctors who will be able to take on this new screening program as well. But to truly make the lung cancer screening a success, we need to go back to the original data. We mentioned earlier that there was such a low number of patients who were screened for lung cancer, 1.9%, compared to the 85% that were given smoking cessation materials. Why is that? Well, it makes sense that so many patients were given smoking cessation materials because it's an important part of billing for Medicare and other insurances when speaking to current smokers. If you put in your progress note that you talked about smoking cessation, you need to also document that you gave patient smoking cessation materials or you can't bill for that part of the visit. So it makes sense. That's the reality of what is out there. So how do we work with that program that is very well established, especially in Arizona? There's a program called the Arizona Smokers Hotline, or ASH, that provides all these materials for all of us providers. So what I'd like to do in order to get this off the ground and at higher rates for lung cancer screening is to make it simple. A lot of times providers and patients don't know where to go or how simple it can be to get the lung cancer screening done. Many don't even know that insurance covers it, like we talked about. So what I'd like to do is to create a sticky note and give stacks of these to local providers that has the criteria for somebody that would qualify for lung cancer screening with check boxes next to it where the provider can just check and give that to the patient along with the smoking cessation materials or by itself and let them know with our information at the bottom where to go, and we'll take it from there to be able to get that lung cancer screening done successfully and then return the patients to their primary care provider once appropriate treatment and follow-up has been established. Many people in programs here in our county that have tried lung cancer screening in years past have done big TV ads, big PR campaigns with minimal success. There needs to be more of a grassroots effort to help the patients who are current and former smokers to understand the simple fact that their mortality may be decreased by as much as 20%, as well as the fact that most insurances cover lung cancer screening if they can get this lung cancer screening done early and at a reasonable time.